So in this video we'll be talking about the median nerve. So this is the axillary artery, and uh, this is the medial cord of the brachial plexus lying medially to the axillary artery, and this over here is the lateral cord of the brachial plexus lying laterally to the axillary artery. Now the lateral cord of the brachial plexus gives a lateral root, and the medial cord of the brachial plexus gives a medial root, and the lateral root and the medial root combine to form the median nerve. So this over here is the median nerve. So this over here is the median nerve. Now the median nerve descends. And first it lies lateral to the axillary artery. So this in red over here is the axillary artery, and you can see that the median nerve is currently shaded in blue, and it is lying lateral to the axillary artery. Then it comes to lie in front of the axillary artery, and then it crosses the axillary artery and comes to lie medial to the axillary artery, and then it descends in the forearm, and then it descends to the forearm, and then it passes between the two head of the and then it passes between the two heads of the pronator teres muscle. So this muscle over here is the pronator teres muscle, and it is passing between the two head of the pronator teres deep to the pronator teres muscle. Now the median nerve doesn't give any motor supply in the arm or in the axilla, but in the forearm it supplies the flexor muscles of the forearm. So the flexor muscles of the forearm are flexor digitorum superficialis. So this muscle over here is the flexor digitorum superficialis. So the median nerve supplies the flexor digitorum superficialis, and beneath the flexor digitorum superficialis is the flexor digitorum profundus. So this over here is the flexor digitorum profundus muscle, and is lying deep to the flexor digitorum superficialis. So the medial half of the flexor digitorum profundus is supplied by the ulnar nerve, but the lateral half is supplied by the median nerve. Now in the forearm, the median nerve travels just beneath the flexor digitorum superficialis muscle. So this muscle over here is the flexor digitorum superficialis muscle, and we can see the median nerve traveling just underneath the flexor digitorum superficialis muscle. So this here is the median nerve. After lying beneath the flexor digitorum superficialis muscle, it travels just lateral to the tendon of palmaris longus tendon. So this is the palmaris longus, and the median nerve travels just lateral to the tendon of palmaris longus, and then it enters the carpal tunnel. So this fibrous arc like structure is the carpal tunnel, and it passes underneath the carpal tunnel to supply the muscles of the hand. Now we will see what damage to the muscle can cause. So if the damage is above the level of the carpal tunnel, so this over here is the carpal tunnel. If the damage to the median nerve is above the level of carpal tunnel, the following muscles would be affected: the flexor digitorum superficialis. So the whole of flexor digitorum superficialis would be affected, and the lateral half of the flexor digitorum profundus will be affected. But the medial half of the flexor digitorum profundus is supplied by the ulnar nerve, so it will be spared. So when you will try to make a fist, you have to flex all your fingers, but since the medial half of flexor digitorum profundus is intact, so you will be able to flex the medial digits, but you won't be able to flex the lateral digits because the lateral half of flexor digitorum profundus is gone. So what will happen that the lateral digits will remain extended, but the medial digits will flex. So it will be seen that the as if you are pointing out to someone. So this is known as pointing index finger sign, and of course the muscles of the thenar eminence will also be affected. So the muscles of the thenar eminence are abductor pollicis, flexor pollicis, opponens pollicis, and adductor pollicis. Now all these muscles, abductor pollicis, flexor pollicis, opponens pollicis, are supplied by the median nerve, but the adductor pollicis is supplied by the ulnar nerve, and the adductor pollicis causes adduction of the thumb. So if the median nerve is damaged, only the adduction of the thumb will be intact. So we will see the adduction of the thumb, which is known as ape thumb deformity. And also we can see that one superficial branch. So this is the superficial branch arising from the median nerve, which is traveling superficial to the carpal tunnel. So this is the carpal tunnel, and we can see this branch is traveling superficial to carpal tunnel. So if there is an injury proximal to the carpal tunnel, both of them will be affected, and there will be loss of sensation over the lateral half of the digits. But in carpal tunnel syndrome, the muscle is already given off to the flexor digitorum superficialis muscle and the flexor digitorum profundus muscle. So these are the tendons of flexor digitorum superficialis and flexor digitorum profundus, and the muscle belly is lying more proximally. So if the nerve is damaged in the carpal tunnel, where the tendons of these flexor digitorum superficialis and profundus are lying, then it means that the nerve supply would have already been given earlier in the course of the nerve. So they are spared. So flexor digitorum superficialis and flexor digitorum profundus are spared in carpal tunnel syndrome, and also this superficial branch. This superficial branch is also spared in carpal tunnel syndrome, since it is not traveling underneath the carpal tunnel but over the carpal tunnel, on the top of the carpal tunnel, so it is also spared. So we won't see any pointing index finger sign, and we won't see any sensory signs in carpal tunnel syndrome. But the muscles to the thenar eminence are going to be affected. So the muscles to the thenar eminence are going to be affected. So we will see the ape thumb deformity in carpal tunnel syndrome.